Welcome back to the ACE-CPT exam prep series. This is lesson 16. We're now in the domain of risk management, professional conduct, and ethical business practices, and today's topic is emergency procedures. This is one of the most important lessons in the whole series. We'll cover facility emergency policies, the cardiac chain of survival, the basics of CPR and AED use, and how to recognize common emergencies like stroke and choking. Nothing here replaces hands-on certification, but every trainer needs this foundation before they ever step onto the floor. Let's look at what you'll be able to do by the end of this lesson. There are 4 objectives. First, you'll be able to explain why facility emergency policy comes first, before any specific skill. Second, you'll be able to list the 4 links of the cardiac chain of survival, in order. Third, you'll state the correct adult CPR compression-to-breath ratio. And fourth, you'll describe AED safety precautions and the standard choking response. Keep these in mind as we go. This lesson is built around one idea. Preparation happens before the emergency, not during it. Let's zoom out before we get into specifics. The big idea for this lesson is simple. Prepare before, not during. There are 3 pieces that make up the big picture here. First, facility policy comes first. That means knowing your AED location, who's responsible for calling EMS, and what the communication protocol is before anything happens. Second, the cardiac chain of survival, which is the sequence of actions: recognition, CPR, defibrillation, and advanced care. That gives someone the best chance of survival. And third, a reminder: certification is still required. This lesson summarizes the concepts you need for the exam, but it is not a substitute for hands-on CPR and AED training. Let's start where every trainer actually needs to start, with facility policy. Before you ever think about a specific skill, like chest compressions, you need to know your facility's actual emergency policy. That means knowing exactly where the AED is located, knowing who is responsible for calling emergency services, knowing what the communication protocol is, who talks to whom and in what order, and knowing what post-incident documentation is required afterward. Here's why this matters for the exam. ACE wants you to understand that emergency response isn't just about physical skills. It's about having a plan in place before you ever need it. Now, let's break down the cardiac chain of survival. This is a core concept you'll be tested on, so let's walk through each link. The first link is early recognition, identifying a heart attack or cardiac arrest quickly. The faster you recognize what's happening, the faster the rest of the chain can begin. The second link is early CPR, starting chest compressions promptly, without hesitation. The third link is early defibrillation, using an AED as soon as one is available. And the fourth link is early advanced medical care, getting EMS involved without delay, so the person gets professional treatment as quickly as possible. Notice the word early repeats in every single link. That's intentional. Every stage of this chain depends on speed. Let's talk through CPR and AED basics, starting with the safety precautions you need to know for the exam. There's a short table of AED safety precautions, and each one has a clear reason behind it. First, keep the victim away from flammables and water. This reduces the risk of fire or electrical hazard when the AED delivers a shock. Second, avoid touching the victim during the shock. This prevents interference with the shock and protects you from injury. And third, never use alcohol to dry the victim's chest. Alcohol is flammable, and it also impairs how well the AED pads adhere to the skin. Now, one more important distinction for the exam. A heart attack and cardiac arrest are related, but they are not the same thing. A heart attack is a circulation problem, and the person is often conscious. Cardiac arrest is an electrical problem. There's no pulse, and the person is unconscious. CPR responds to cardiac arrest, not to chest pain alone. That distinction shows up often on exams, so hold on to it. Let's move to stroke recognition, using a method you'll want to memorize: FAST. F stands for face drooping. Ask the person to smile and check whether one side of the face droops. A stands for arm weakness. Ask them to raise both arms and watch for one arm drifting downward. S stands for speech difficulty. Ask them to repeat a phrase and listen for slurring. And T stands for time to call emergency services. Note when the symptoms started and call immediately. Don't wait to see if it passes. FAST is designed to be simple enough to remember under pressure, because that's exactly the situation it's meant for. Now let's cover choking response. For a conscious choking adult or child, the standard response is abdominal thrusts. For infants, it's back blows and chest thrusts instead. You continue either technique until the object is dislodged or the person loses consciousness. Here's the thread that ties this whole lesson together. Across cardiac emergencies, stroke, and choking alike, the pattern is the same 3 steps. Recognize what's happening, activate the plan, and then apply the skill. And one more reminder before we move on. This lesson summarizes CPR and AED concepts for exam purposes. It is not a substitute for hands-on certification. You'll still need that separate hands-on training to be truly prepared. Let's test what we've covered with a practice question. What is the correct order of the cardiac chain of survival? Option 1, advanced care, CPR, recognition, defibrillation. Option 2, early recognition, early CPR, early defibrillation, early advanced medical care. Option 3, defibrillation, recognition, advanced care, CPR. Option 4, CPR, advanced care, recognition, defibrillation. Take a moment to think it through. The correct answer is option 2, early recognition, early CPR, early defibrillation, early advanced medical care. Here's why. The chain proceeds in exactly that order. You recognize the emergency first, then start CPR, then defibrillate as soon as an AED is available, and finally, advanced medical care takes over. Each step depends on the one before it. Here's our second practice question. What is the correct compression-to-breath ratio for adult CPR? Option 1, 15:1. Option 2, 30:2. Option 3, 10:3. Option 4, 5:5. Take a moment to think it through. The correct answer is option 2, 30:2. Here's why. Adult CPR is delivered in cycles of 30 compressions, followed by 2 rescue breaths. That ratio is a number worth memorizing exactly, because it's a common exam target. Let's recap the key takeaways from this lesson. Know your facility's emergency policy before an emergency ever happens. That's your starting point, always. Remember the cardiac chain of survival: recognition, CPR, defibrillation, and advanced care, in that order. Adult CPR is 30 compressions to 2 rescue breaths. Keep that ratio locked in. And finally, remember that this lesson summarizes concepts for exam purposes. It does not replace hands-on CPR and AED certification. Those 4 points cover the heart of what you need for emergency procedures on the ACE-CPT exam. That's a wrap on Lesson 16. In Lesson 17, we're covering legal guidelines and professional responsibilities. We'll get into negligence, informed consent, employment status, and liability insurance. See you in the next lesson.